let's take a journey inside one of your body's most underappreciated powerhouses. We're going to go on a guided tour of the stomach. It's a simple question, right? But the answer is anything but simple. That meal you just had, it's on this incredible internal adventure, and we're going to follow it to its first major stop. And here it is. This is the stomach, tucked away neatly in your upper left abdomen. But don't let that simple J shape fool you. This is not just some passive little pouch. It is a powerful, dynamic organ that really kickstarts the whole digestive show. Honestly, the best way to think about the stomach isn't as a bag at all. It's more like a high-tech, muscular blender, where chemistry and raw mechanics just collide. So one of the stomach's superpowers is that it's distensible. That's a fancy word that just means it has this incredible ability to stretch and expand. And that's absolutely crucial because it lets the stomach act as a temporary holding tank for food while it starts the real hard work. And just how much can it stretch? Well, get this. When it's empty, it might only hold about 30 milliliters. But after a big meal, it can balloon up to hold as much as 2 liters. That's a massive, massive increase in volume, all thanks to those muscular, super flexible walls. Okay, so now that we know how powerful it is, let's get out our map and explore the actual geography of the stomach. This is where we're going to learn the key landmarks on our tour. This diagram right here is going to be our guide. And to keep things really simple, just remember the rule of twos. The stomach's main features can be broken down into 2 openings, or doors, and 2 distinct curves, or borders. First up, the doors. At the very top, you've got the cardiac orifice. That's the entryway, where food drops in from the esophagus. Then, way down at the bottom, there's the pyloric orifice, which is like a tightly controlled exit door leading out into the small intestine. Now, let's trace the borders that give it that classic J shape. The short inner curve on the right, that's the lesser curvature, and the long, sweeping outer curve on the left is the greater curvature. Pretty simple, right? Together, they create the organ's whole framework. Internally, the stomach is also split into a couple of regions. The upper dome part is called the fundus, and the main central part is the body. Think of these together as the primary holding area. This is where your food hangs out while all those powerful acids and enzymes start breaking it down. Then you've got the lower section, known as the pyloric part, and it acts just like a funnel. It churns and mixes the food into a paste, and then the pyloric canal carefully controls its release through that exit door we talked about into the small intestine. You know, an organ like the stomach doesn't just exist in a vacuum. It's part of a really bustling neighborhood. So let's zoom out for a second and see who its neighbors are, the other organs it's bumping up against every single day. The stomach's position is really important. In front of it, you've got several organs that act kind of like a protective shield. And behind it, there's a whole collection of structures that form what doctors call the stomach bed. It's basically a cushion for it to rest on. So who are these frontline protectors? We're talking about the huge liver, which partially covers it, the diaphragm muscle sitting just above it, and of course the abdominal wall itself. They all work together to shield the stomach from the front. And what about that bed it rests on? Well, it's a whole crew of critical structures nestled right behind it. You've got the pancreas, the left kidney, the spleen, and even parts of the colon. The super close proximity means all these organs are working in a tightly coordinated neighborhood. So we've toured the physical space, but all of this anatomy serves a purpose, right? Let's talk about what the stomach actually does, what its main job is. The stomach's entire design really boils down to 2 main functions. First, it's a reservoir. It holds onto food so we don't have to eat constantly. And second, it's a powerful mixer, churning that food with digestive juices to create a nice, manageable paste for the next stage of digestion. Of course, with an organ that's so complex and works so hard, things can sometimes go wrong. And that brings us to its clinical relevance. And it's why understanding all this anatomy is so incredibly important in medicine. So 2 of the most common issues are directly related to the stomach's lining and all that acid. Peptic ulcers, you've probably heard of them, are these painful sores that can form when digestive acids actually start to erode that protective inner wall. And gastric carcinoma, or stomach cancer, is a more serious condition where malignant cells form in the stomach's lining. So when a problem is suspected, how do doctors continue the tour, so to speak? They have a few key methods. They can use chemical tests to check out the stomach acid. They can use imaging, like a barium meal, to see the stomach's shape and how it moves, and they can do an endoscopy, where a tiny camera goes in to take a direct look inside. And that brings our tour to a close. We've seen its structure, we've met its neighbors, and we understand its vital role as the body's blender. It kind of leaves us with a final thought, doesn't it? When you consider everything this amazing organ does for us, day in and day out, what can we do to help it perform at its best? Thanks for joining me.